Okay, so welcome to this next video in which we are discussing the role of nitric oxide in controlling blood pressure. Okay, right, so what we now want to look at is what happens if arterial blood pressure goes up. Now you might wonder, why should we care? Well, arterial blood pressure being too high is not good, basically. It damages the walls of the blood vessels and can lead to atherosclerosis, is one of the major things that you risk if you have too high blood pressure, because atherosclerosis comes about because of injury to the endothelial cells that line the blood vessels, and it can lead to, 50% of the Western world will now die of complications arising from atherosclerosis. So, if you get atherosclerotic plaques in your coronary arteries, that can stenose the coronary arteries, and that can lead to myocardial ischemia and then infarction of the myocardial tissue, known as a heart attack. Okay, and a lot of people are killed by heart attacks. If it happens in the brain, you can get ischemic stroke. Again, people die of that. It can also weaken the walls of the aorta, leading to aortic aneurysms, and people die of aortic aneurysms. So a lot of people die of complications that come about because of atherosclerosis, and a risk factor for atherosclerosis is too high blood pressure. So blood pressure being too high is not good, basically. So, what physiological mechanisms does the body have to try and maintain blood pressure? Because even more extremely than that, if blood pressure completely wasn't controlled, then it would lead to just tissue damage. It would just not be a sustainable organism. You'd get blood vessels bursting open, basically. So you need to control blood pressure. Okay, so what mechanisms does the body have for controlling arterial blood pressure? Well, basically, let's have a look at how nitric oxide works. And by the way, the body has a lot of mechanisms for controlling blood pressure. We're going to look at the role of nitric oxide. So, let's start with arterial blood pressure going up. And when people say blood pressure, they mean arterial blood pressure. Venous blood pressure doesn't really go up that much. It usually stays at this very, very low value of 3 to 8 millimeters of mercury. Right, so if blood pressure has gone up too much, then why might that have occurred? Well, it might have occurred because the heart is beating too fast and pumping too much blood from the venous to the arterial system. That will cause arterial blood pressure to go up. So what's the solution? Well, the solution should be simple. It's to return the blood that's in the arterial system back into the venous system. So what we need to do effectively is we need to help the blood go back from the arterial to the venous system to try and return our arterial blood pressure to a reasonable value. Okay, now physics will help us a little bit, because if we raise the blood pressure here, if this arterial blood pressure has gone up, so let's say if blood pressure has gone up, then what that will cause is it will mean that the flow of blood from the arterial to the venous system is going to increase, because there's a greater push on this blood, so the blood's all going to start moving faster through this tube. So that's going to mean that the amount of blood that you move from the arterial to the venous system in a certain amount of time, i.e. the blood flow, is going to increase. So that's one way. Physics is going to help us, basically, to return the blood from the arterial to the venous system. Okay, but basically, biology is going to come in now, and it's going to help this even more. It's going to help increase the flow of blood back from the arterial to the venous system even more, to try and return this arterial blood pressure back to normal. Okay, right. So how does this happen? Well, basically it happens through nitric oxide. So, if we draw this blood vessel that connects the arterial and the venous system, then I've told you that when the blood pressure goes up, flow from the arterial to the venous side is going to go up, and that means that the blood actually is going to be moving quicker through this tube. Now what that's going to result in is it's going to result in an increase in the hemodynamic shear stress on our endothelial cells of the blood vessel. Remember what I mean by hemodynamic shear stress. I mean basically this endothelial cell is made up of molecules, remember. Okay, and the blood is made up of molecules as well. Well, what's going to happen is when you have a fluid, this blood moving parallel to the surface of the endothelial cells, some of these molecules that are within the blood are going to hit the molecules of the endothelial cell, and they're going to push it in this direction. So the endothelial cell is going to overall feel a force in this direction, in the direction that the blood is moving. This is what is meant by the hemodynamic shear stress. This push, this push on the endothelial cells that occurs in the direction that the blood is moving because the constituents of the blood are bashing into the endothelial cell effectively. Okay, so when this blood starts moving quicker, what's going to happen to the shear stress? Well, the constituents of the blood are now all moving faster, so the bash they're going to give to the molecules of the endothelial cell is going to be greater. So the hemodynamic shear stress, this force in the direction of the blood flow that the endothelial cells feel, is going to be greater, basically. Okay, so what's that going to cause? Well, we know what that's going to cause. It's going to cause these endothelial cells to release nitric oxide. Okay, so when hemodynamic stress goes up, shear stress goes up, endothelial cells start releasing nitric oxide. And if you want to know the mechanisms by which that happens, I advise you watch my videos on hemodynamic shear stress and endothelium-derived relaxation factor. And remember that nitric oxide is also known as the endothelium-derived relaxation factor. If you don't want to know the molecular mechanisms, then continue watching. Right, okay. And it's fair to say that the molecular mechanisms that underpin this release of nitric oxide are still quite fuzzy. Okay, so nitric oxide is released by the endothelial cells. Now, what does this cause? Well, maybe not if this is a capillary, but if this is an arteriole, this blood vessel is going to be surrounded by a layer of smooth muscle. Okay, so let me just remind you of the basic structure of a blood vessel. So if this is our blood vessel here, then if this is the lumen right in here, then we have our endothelial cells sitting here, maybe a little big, but that looks more like an atherosclerotic plaque than an endothelial cell. But here are our endothelial cells lining the blood vessel, and they sit on a layer of collagen known as the basement membrane. So I'll colour this in turquoise, and together this basement membrane with the endothelial cells is known as the tunica intima of the blood vessel. Okay, so these two things together here, those are tunica intima. Tunica means a layer, intima means close, so it's the layer that is close to the blood. Now, outside of that, you then have smooth muscle cells, which are arranged in a circular fashion, like so. So you have them joined together in a circle, like so. Okay, let me just straighten my page back out. So here's our smooth muscle cells, joined together in a circle. And these are in a layer which consists of a lot of smooth muscle cells and also a lot of elastic tissue, which is known as tunica media. So tunica again means layer, media means middle, so it's the middle layer of the blood vessel. Okay, so this will be the layer of smooth muscle and elastic tissue. So this now here, will that be tunica media? Okay, and then the final layer of the blood vessel, which is known as tunica adventitia, is a layer of connective tissue surrounding the tunica media. So it's generally collagen, tunica adventitia. Yeah, there. Okay, so I'll put this around the outside in yellow. Okay, so here's this layer of collagen that surrounds the tunica media. So this overall are the different layers of a blood vessel. Now, when these endothelial cells sense this too high shear stress, what they do is they release the nitric oxide, which is going to go onto these smooth muscle cells surrounding the endothelium. The smooth muscle cells now relax in response to this nitric oxide. And when they relax, they all become longer. Now, if you can imagine what happens when all of these smooth muscle cells become longer, what's going to happen is the circumference of this ring is going to go up. And if the circumference of the ring goes up, the diameter of the ring goes up. So what's going to happen is the whole blood vessel is going to increase in diameter, and the lumen's going to increase in diameter. So what effectively happens when you sense this too high shear stress, which occurs because the flow is too fast effectively, that's going to cause these blood vessels to vasodilate. So these here, this tube connecting the arterial with the venous system, it's going to basically become wider, okay, in response to the increased shear stress. Now, if the tube becomes wider, what does that do? That allows more blood to flow through it, okay? So it means that blood can flow from the arterial back to the venous system quicker. Okay, so this is how biology helps. Physics meant that blood was going to be flowing quicker, and that was going to increase the blood flow back from the arterial to the venous system. Biology then says, okay, we'll potentiate this, we'll make it big, this effect bigger, by widening the blood vessel so that more blood can now flow through. So we're going to increase the flow of blood back from the arterial to the venous system even more, basically. So this is how biology is going to potentiate the physics to help return blood from the arterial to the venous system and lower arterial blood pressure. Now, when arterial blood pressure goes back to normal, what will happen is then the shear stress will drop off, and then the blood vessel will vasoconstrict back to its normal level, basically. Okay, so that's how nitric oxide is going to help regulate blood pressure. It's this sort of inbuilt mechanism to help return blood from the arterial to the venous system if blood pressure goes up too high, basically. Okay, and in the next video what we'll talk about is what happens if you inhibit this in animals.